Ryan Patrick here. Today we're going to talk about how to conquer the inline lunge. So a lot of people come in and we use the functional movement screen as a part of our assessment process. And when we see a deficient lunge pattern, it really kind of highlights a few things that we might need to address. So we're going to talk about the whole relationship of mobility to stability through the lower chain and through the upper chain and how the core integrates with all of that. So in its basic iteration, the lunge is going to involve a very narrow base of support, so it's going to challenge balance as well. Hands are going to be positioned here so we can see where the spine is, and we're going to ask people to go through a lunge pattern a couple times. So right away, we're looking at some issues with the lower body if they're not able to do this. Obviously, the most important one is pain. If we see pain, we either want to refer out or maybe kind of dig a little deeper and see if there are other assessments that indicate why the person might be feeling pain. Balance is going to be a huge one, and not one I'm really going to cover here, although a lot of people seem to have insufficient core timing, core strength when it comes to the ability to balance. So starting with the lower body, one of the first things we want to address is mobility. So do they have enough range of motion through the lower body to be able to achieve the lunge that we're looking for? And we often use a 90-90 split squat, looking at can they create that hip separation and can they create it while keeping a neutral pelvis. So a lot of people are unable to demonstrate when they're in a 90-90 stance the ability to keep that pelvis neutral. We see a lot of anterior tilt. And so we want them to be able to get back to a pretty neutral pelvis so that as they lower, we know that back thigh is being extended and you're going to feel a lot of rec fem stretch, and the front leg is able to go into flexion. If they're unable to do this without any shifting out of it, slipping into an anterior tilt, forward trunk lean, we know mobility is probably one of the issues, or at least mobility under that amount of load. So if it's deficient, we'll pop down, and a lot of times we'll have people utilize the kneeling quad stretch, kneeling quad mobilizations, both as part of the warm-up when we're doing some diaphragmatic breathing, and as a finisher, part of their cool-down. So addressing the mobility is going to be the first priority, because bottom line is if they don't have that mobility, we need to make sure that we address that first. When we're looking at stability, what I want people to do is demonstrate that they can maintain a tall core while able to go through a bunch of patterns. And so one of our favorites to utilize for people who don't have enough stability initially is a half kneeling chop and half kneeling lift pattern. Now, we don't have any cables here, so our chops are done with bands. They look a little bit different, but either way, we're going to pull that band out, go into a punching pattern just to create that torque, see if people can maintain that tall torso, and then as they bring the band back in, we're going to finish the exercise off. This is great for getting people into a 90-90 position, forcing a little bit of extension on that back hip to make sure their glutes are tight, getting their torso tight, and overall creating a semblance of that pattern that we want. That bottom position is the toughest to hit for people. They can usually get into a 90-90 stance. So we want to make sure that at the bottom they've got the requisite stability that they need. If there's pain, one of the things we'll do is take people through a 90-90 split squat pattern with a band and see if they can hit that entire pattern without any pain. So we unload their body as much as needed for them to maintain proper technique through the entire exercise. If the joint angles can stay at a 90-90, if their torso can stay tall, their pelvis can stay neutral, and they can go through that pattern with assistance and no pain, then it kind of points to an indication that their ability to stabilize under the load of their body weight is more of the issue. And so they demonstrate that they do in fact have the mobility to go through a 90-90 split squat. However, with their body weight, it seems to be too much load. And so we have no problem kind of coupling up the approach here, using the chop and lift patterns to rebuild that stability at the bottom and give them an assisted split squat so they can learn to maintain through that position. Another alternative, if you don't have access to the bands or you're in a group setting, is we'll have people do isometric split squats, going down into that position where they start to break form, whether it's pelvic tilting, trunk leaning, and we have them hold that for a length of time, finish with an eccentric as they lower down to that 90-90, and then from there we'll have them just build up time. The isometric is going to give you a little bit of a leeway in strength, plus or minus 15-20 degrees. That is going to allow them to gradually build up strength through that pattern, and then we can start to take them through some body weight reps and ultimately into some weight. So to conquer the lunge, there's really just a couple things that we need to address. If you can't lunge or do a split squat in place, I'm not really comfortable with you being dynamic. I don't want you to step forward and absorb the impact on that lead leg, which could be a lot of knee shear forces, could be a lot of valgus stress. It could present as a lot of different things. We want people to control static positions first before we really get them dynamic and start doing walking lunges, reverse lunges, what have you. Typically, we progress people from a static position to a reverse lunge. It does tend to be a little bit more hip dominant, so it kind of blurs the lines between what is our quad dominant, what is our hip dominant work, but it tends to be a little bit friendlier to the knee. So as we're starting to get dynamic, we're still not imposing a ton of stress to that stabilizing and working knee, which makes it an easier transition for people to get strong. So this is our pattern for progressing through the lunge.